We are watching Live on Lakeside, and our next guest is Dr. Lisa Meek. She is an aesthetic medical skincare and laser specialist at the Parker Clinic.
Yeah, thank you so much for joining us, Dr. Lisa.
Thank you for having me.
Really appreciate your time. Absolutely. So tell us what you're seeing in terms of trends with aesthetics.
So more and more people are looking into these things like Botox and fillers and body contouring. What we're finding is, yes, there are some younger, but it's not without reason in that you can be more preventative if you start doing things earlier rather than waiting for the lines to get too heavy and too deep. But the real trend is people want to look more natural. They just really want to look more like a refreshed who they should be in the first place, as opposed to the old frozen look that we see on the reality shows and the other things.
Right.
Yes, you don't want to look fake.
No,
you
you
want to
do
look
not.
like yourself.
You do not. Right.
What would you say people are most afraid of when it comes to this?
Well, there's a lot of misconceptions if you've never done any of these things that you can Botox these lines, which would never work. You wouldn't be able to smile, or how fillers work, what's natural, what's not natural. So it's basically just misunderstanding of what we really do. And even if you don't want to do Botox and fillers, there are a lot of facial treatments and things you can do to keep your skin looking healthier and younger. And regardless of your age, healthy young skin looks good. So it doesn't matter if you're 80 or you're 30. If the skin looks healthy, you look younger and refreshed.
Absolutely. Talk to me a little bit more about body contouring.
So that's the new wave that we're seeing come through, and there are many devices out there. It is not a substitution for plastic surgery, but it's an alternative to somebody who doesn't want to do liposuction or tummy tucks. And there are various devices that we have out there, from freezing the fat radio frequency devices. We have a new one that's a magnetic pulse device, and you also have ultrasound devices. Those are the main things that are out there right now that can help to shape, get rid of the little fat roll, make things look a little nicer in your clothing or your bathing suit. And it seems to be a huge trend that's moving forward.
Okay. A lot of times I feel like we just assume women get this stuff done. But men
I'm gonna need some help here in a couple of years. So
stop. But men do take advantage.
They do.
And what are are there more common procedures than others that you are noticing in men?
So men are coming on board about taking care of their skin as well now. And so we're seeing soft Botox, just a little bit to soften those heavy lines through here and through here. Facials, taking better care of their skin. And the body contouring still counts for the guys too, because they want that.
Yeah.
what are some tips that you might give folks that are watching just so that they can take advantage of a more youthful and healthy look?
Well, my patients hear me say it all the time: sunblock, sunblock, sunblock. And if you do nothing else in your life, please do sunblock, because it really does age the skin, and it's also not healthy because of skin cancers. So that would be the most important thing. And taking care of your skin. If you're not going to do the Botox and fillers regimen, you can still apply really good products that can make a difference in how your skin ages.
I'm just going to go ahead and ask it. I mean, are there any risks to using things like Botox and fillers?
Well, there are always risks with anything. If anybody tells you they aren't, they're not telling the truth.
Okay.
But they have been used in so many millions and millions of people with so few problems with it that as a whole, it's fairly easy and less risky than people think.
Yeah.
So if I am someone that is considering, using Botox or one of the other services that you provide, talk to me about what I can expect when I show up.
So we'll have a conversation. We'll talk about what are you looking for? What brought you here in the first place? And then we talk about your expectations, because I think expectations are huge. If somebody thinks that we can change the clock by 20 years, they're going to be disappointed by what we do. And also understanding where you're coming from. How much do you want to see a difference in, or do you want it to be an extremely subtle difference? And we work with that. I'm never going to let anybody leave my office looking like something I don't want them to look like, so you don't have total say on it.
Right. And then with the body contouring, I'm just curious, is that a procedure once you're done with it, you're done, or do you have to do it every so often?
It depends on which treatments you're using. Most of them for the fat reduction, the fat cells are destroyed. So those cells that you kill off are gone. And unless you have a significant weight gain, 20, 30 pounds or more, you won't be producing more fat cells in that area. If you don't take care of how you're eating, that area that you treated will look better than the areas that haven't been, but you can still gain weight, and so that's part of it. So if you maintain, you can be done with your treatments.
Dr. Lisa Meek, thank you so much for sharing your insight with us. We really appreciate it. And of course, we want to give everyone that's watching an opportunity to take advantage of your services. All you have to do is click online. That's www.theparkerclinic.com for more information.
Right there.